Come on in. Hi. Good morning, Mr. Jim. It has been a long while since we met last time. I think probably 6 months back we met. Okay. So it has been long. So how are you doing? And how is your blood pressure? And otherwise, how is your general health? You're going for a for daily walk? Ah, that's great. And how many times you are checking the blood pressure? Yeah, that's fine. Daily is enough. Uh, Otherwise, everything is good and back at home. Okay. Uh, Mr. James, I ask you to come today to take an appointment because of some issue. There has been recent recall of a drug Z, which you were taking. Recall means that the drug, there was some concerns of suspicion of cancer, so that drug has been removed from our pharmacopoeia, and has been we have been advised to change the medication as per NHS. I'm really very sorry, Mr. Jim, that you are. I'm sure I will be concerned. I am concerned. That's why I called you to come and have an appointment. Uh, this drug Z has been one of them which went through the cracks, and probably it was missed. Now they have informed that there is suspicion that it can cause cancer in long term. I know, I can understand that you have been taking this medication since last 7 years. One of the reason is that either it had went through the crack 7 years, 10 years back, or either the supervisions and assessment had been more stringent and more molecular level examination is done on the drug. So we found out that there is a suspicion of cancer, and it has been advised to be recalled from oral pharma banks. Yeah, I can understand your concerns. I know that you are taking care of yourself effectively and your blood pressure is well controlled with this medication. But after a recall, as per recommendation, we have to change this drug. Um, Actually, in fact, I have already selected a drug for you that is called drug X. Um, yeah, I can understand your concerns, but I reassure you that this drug is not does not have any side effects like the previous one. It has been in the market since last 2 decades, so I think it would be beneficial for you to change the drug. And I can understand your concerns. I'm really sorry to discuss this situation with you, but Mr. Jim, try to understand that you are okay. That's good thing that your health is everything is in perfect situation. After a recall, we will change the medication. It will be very dangerous of you to rely on natural remedies. Natural remedies by itself are very effective, but given your age, this can be very dangerous and can be catastrophic. Natural remedies are not as good for control of blood pressure, and can make you at a high risk for stroke as well. Yeah, Mr. Jim, thanks for understanding. What we will do is that I will prescribe you drug X at this moment, and we have to check you weekly to check the response, and then after we can schedule the appointment 3 monthly. Okay, try to understand the situation, Mr. Jim. Um, I'm really sorry if you are so much worried. I, I, I can understand your situation, but what else you can do is that we can continue with the drug X and take all the precautions for you, and I think you will go on to do very well.